Quickly we're going to see the personality disorders. Personality disorders are clustered in 3 clusters. We have the cluster A, B, and C. The cluster A includes paranoid personality disorder, schizotypal, and schizoid. Personality disorder type C or cluster C has the avoidance, obsessive compulsive personality disorder, and the dependent type. And the cluster B, that has the more gamma of personality disorders, include the antisocial, histrionic, narcissistic, borderline. Alright. So in the patient with cluster A is weird. In the paranoid, it could look like schizophrenia. The mechanism of defense that these patients utilizes is usually the projection, so they are all the time scared, and so if they stole things, they can have a projection in which they think that other people is stealing to them, etc. The paranoid personality type is all the time like very arousal and is asking a lot of questions that why everybody is questioning the patient. Schizoid, the patient doesn't like to socialize and likes to be alone. Sometimes can have a bit of a fantasy about likes video games or something like that, but the person is isolated, and that's what the person likes. Schizotypal, the patient has magical thinking, and things like can see with a bubble or a crystal ball or something, magical thinking, and so the people around avoids to be with the schizotypal personality disorder patient. So in schizoid and schizotypal, the patients could be isolated, but in schizotypal is because the people doesn't want to be with the person, even though the person is all the time there and wants to be in every place, and the schizotypal doesn't want to socialize. Cluster C, because I think that the cluster B is the most difficult. Cluster C, the avoidance type, the patient wants to socialize but cannot due to fear of do something wrong or to be criticized or disliked or something. So the avoidance percentage is that avoids to go to socialize, etc. The patient wants but avoids to do it because doesn't know how it's going to do if the person does something wrong, or if the people criticize them, or the people, or the person. Obsessive compulsive personality disorder, we already talked about this, the difference between obsessive compulsive disorder and obsessive compulsive personality disorder. Here the patient is egosyntonic, but even though it is egosyntonic, in this case this person is good because the thing that is doing the obsession or the compulsion is something that is making better to the patient, like to wash the hands all the time, or to have order on the desk, etc. The dependent personality disorder is a patient that it feels dependent usually of the partner or of the parents, and so cannot do anything without them, and could have 30 years old, etc., and cannot do anything without them. For that is dependent personality disorder. Personality disorder and avoidance could see kind of the same thing, because they both avoid to go out or to do things, but the avoidance can do things if other people is asking to do it, in a sense of like buy something or etc. These patients with avoidant personality disorder cannot disagree with the other people. And the dependent person is, if it is alone, cannot do anything. It needs to be with the parents or with the partner, with whatever the patient feels dependent of. And they can have depression as well. Antisocial personality disorder, we already talked about this in other videos, in which the patient destroys things, violates the rules, etc. So this is kind of the bad person. But it needs to be older than 18 years of age, and usually with some symptoms around the childhood, so before 18 years of age, but the diagnosis of antisocial personality disorder is after 18 years of age. If it is before, it is usually called conduct disorder. Histrionic personality disorder versus narcissistic. Histrionic, the patient needs to be the center of attention, and could dress dramatically, speak dramatically. The dress could be colorful, because wants to call the attention, wants to be the center of attention. This is histrionism, when the patient acts whatever is doing, so this is seen in theaters patients. Narcissistic, and the relationship in histrionic personality disorder, the patient perceives them as being strong, but they are very superficial. The narcissistic personality disorder, the patient thinks that is the best person, so demands the best, gets angry if other people is not doing what this person is saying, or if someone else gets something better than this person. So if the person is on the consult, and they is going to be hospitalized, request a personal room, and if it is taking too long, the patient says that they are wasting the time of the patient, etc. Because the narcissistic personality disorder is that the patient thinks that is the best person, so thinks that deserves everything the best. In a sense, this is the hyperbolic example of Dunning-Kruger effect, in which the person believes that is something that is not. And borderline personality disorder, the patient can have psychosis, as well as the patient with cluster A, for example, schizotypal. Here the patient can have brief types of psychosis, but they also have self-injuries. They injure themselves. The relationships, they perceive them as very strong, so they are emotionally liable if they are not with other people. In borderline personality disorder, these patients are suicidal. This is a very, very awful situation. They have splitting. They think that everything is very, very, very good, the best of ever, or everything is completely awful. This is the worst of them, because this has self-injury to the patient. So the cluster B, narcissistic versus histrionic, they can look similar. The difference is that narcissistic is the best person, thinks that is the best person. Histrionic, the patient demands being the center of attention. Personality disorder, awful, suicidal ideations, self-injuries, perceived as strong relationships, even though they are superficial, and the psychotic episodes. The cluster A can have paranoid, schizotypal, in which the patient avoids the things, or schizotypal is when the people around avoids the patient, and schizo is when the patient avoids the other people. And cluster C, we have the avoidance that cannot disagree, the dependent that depends on other people, and the obsessive compulsive personality disorder.